Private healthcare group Netcare has raised concern about a shortage of nurses in the country. It's blaming government for imposing limitations on the number of people it can train, for example, for the 26 to 62,000 shortfall in personnel. Denosa's Deputy General Secretary, Khaya Sodidi, is with us tonight to talk about this. Khaya, very good evening to you. Always good to have you on News at Prime. Do you share the Netcare group's concerns about a looming shortage, as it says, of nurses? And we've already been speaking to other groups who say it's already playing out at ward level.
Good evening, Temekile, and to the viewers. Of course, we share the same sentiment raised by Netcare about the gross shortage of nurses in the country. It's been coming, this has been coming for many years now, more than 10 years. We've been raising that if the shortage of nurses is not being addressed in the country, we are going to have a crisis in the near future.
And when you say that, for example, Netcare, not you, but Netcare is warning that, for example, many of the nurses, many healthcare workers are nearing retirement. That's in around 2030, where it says we're going to see a significant number out of the system due to age. We're now in 2023. It leaves us with 7 years or so to try and build up more personnel, get experience as well. Are you seeing efforts in earnest to make that happen so that we don't have a crisis?
Unfortunately, not really. Of course, our government or the department promises to do something about the situation, but in reality and practical on the ground, we don't see that really happening. Because remember, what brought us where we are now today, 10 years or 15 years later, is the closure of the nursing colleges. Because in the country, the majority of nurses are coming from government, public sector, training institutions, which have been closed down immediately, some immediately after post-democracy. And as Denosa, we've been making noise that we need to reopen those colleges because the bulk of the training or production was coming from those nursing colleges. The universities and the private sector like Netcare, they are really training a small portion of the nurses. So unfortunately, unless those colleges are being reopened, as have been making the call as Denosa, we don't see really any seriousness or anything that will address the current situation of the shortage of nurses. And in addition to that, it's what has been now the transformation of nursing education. Was now nursing education has been now been transformed now, which is now has been taken to Department of Higher Education, which complicates things now, whereby now the colleges and some institutions, including private healthcare, Netcare and life healthcare, making them unable to train the nurses the way they should be because of the new Nursing Education Act, which has been introduced, which is making things really difficult to train the number of nurses as should be.
Right. And Netcare CEO was saying in this piece that I was looking at that they, as a group, have capacity to train about 3,500 nursing staff, but at the moment, they're only basically accredited to train about 10% of that. So with those numbers, how long would it take South Africa, do you think, to build up enough personnel to make sure that in the next 7 years, when we're expecting this mass exodus, not exodus, but retirement wave, that we do have people in place to carry on the job?
If we start now, Temegile, it can take between 5 to 10 years to try to mitigate the situation. But of course, it won't address the crisis now we're faced with. It will just mitigate. Because remember, every day, natural attrition takes place. Some they retire, some they die due to natural death, causes of natural death, and so on. So every day, somebody leaves the bedside nursing. Some they go abroad, they go overseas. Some they change the career. So every day, the people are leaving the services. So when we are saying between 5 and 10 years, it will just alleviate the situation, but not necessarily addressing the shortage of nurses. If one to address the situation now, the gap we're having currently, the vacancies, which is between 26 and 60,000, we need many more years. We need 10 years and more to address that.
And this problem is made more painful, in fact, for nursing graduates because many are sitting at home, unable to get work because the constant refrain is that there's simply not enough money to hire all the doctors and nurses who say they are willing to work. So how do we balance that? Warnings or a reality that's creeping in of a shortage of staff, yet there are people who say they want to work, but there aren't enough posts that are funded for them to get into work.
Correct, Temegile. We've got the number we know from Denosa side is about 5,000 nurses sitting at home. Those are newly qualified and others. But the number can go up to 20,000. Apparently, those nurses who are just sitting at home idling in total, including private sector. Now, the problem we are having in the country, Temegile, to employ those nurses is the issue of the budget constraints. That is our enemy number one, because we are told that, especially by government, our government, that they just simply don't have money to hire those nurses who are sitting at home. So it's a serious challenge that unless the budget is being made available, so that we can start employing those nurses who are idling, sitting at home, and then we can start training others. So it's a crisis which is waiting for the country just to erupt, which is something we don't want to see. Of course, private sector also they are coming in the picture, but you know that private sector can only the small percentage. They might be having money or to employ nurses and so on, but if there are no nurses really to employ, which are not enough, then there's nothing much they can do really.
And the difficulty for public institutions is that you've got this shortage playing out, right? But you also have workers growing up. This was what was happening, so you can correct me if I'm wrong. People who work in public but want to go into private healthcare or take up jobs elsewhere around the world. Is that still happening?
Yes, it happens. Yes, of course. The issue of the movement of nursing personnel or migration is a daily issue. Like I said, that some of people, they go abroad, they go overseas. Some they leave public sector, they go private sector. But the same can be said by those who are moving from private sector to public sector. In fact, what we have discovered, Temegile, for the past few years is that we are recycling the same nurses, really. You know, today, private sector will advertise 100 posts. Then you see nurses from moving from public sector apply for those posts in private sector. The same, you see public sector advertising 100 posts, and then you see nurses from private sector moving to public sector. So then you realize that we are not going anywhere. It's just we're recycling the same nurses. And then also those who go overseas, some they go privately, some go to NGO. We're using the same nurses, so we're not going anywhere as a country, really.
Thank you very much for that, Khaya Sodidi from the Nursing Union Denosa. Thank you for your time.